All right. Hi, everyone. Good morning, and thank you for joining us for today's Pilates Rehabilitation Physical Therapy Expert Panel. I am Krista Osio, physical therapist and PR chair for the San Jose District of the California Physical Therapy Association, or CPTA, and who's organized the presentation for today. So first, I would like to share that today's panel is actually part of a series hosted by the San Jose District with the goal of educating our community about specific treatment types within physical therapy. So in the past, we've covered aquatic therapy, vestibular therapy, pelvic floor training, as they pertain to the geriatric client or patient. And in our Marathon Essentials PT Expert panel, the experts covered a recommended training program, cross-training for injury prevention, training strategies, and tips for the postpartum runner, specifically related to preparing for the Big Sur International Marathon, which is one of the largest attended events within the San Jose District. So for today, physical therapists Ariel, Lehaitre, and Magda, Nowosielska will discuss why they use a combination of Pilates and traditional physical therapy to achieve their patients' desired outcomes for general orthopedic and pelvic floor needs. They'll talk about some of the differences and also the complementary aspects between Pilates and Pilates rehab to best serve our patients' and clients' bodies. So with that, please allow me to introduce Ariel Lehaitre. Ariel is the founder and owner of Pilates Santee. She is a highly skilled physical therapist and Polestar certified rehabilitation specialist in Pilates-based exercise of 20 years. She received a BS in clinical exercise physiology and an MS in physical therapy from Boston University in 2002. Ariel worked as a Polestar Pilates mentor for their teacher training program from 2011 to 2016. She has completed additional specializations, including Coraline, Pilates for osteoporosis, Pilates for the OOV, she'll have to correct me on that if needed, and Pilates adaptations for scoliosis. Okay, so Ariel, if you would like to take over, you could share your presentation and begin.
Can everyone see my screen and hear me okay?
Yes.
Okay.
That's great.
Thank you so much, Krista. I appreciate this opportunity. I'm very passionate about Pilates rehabilitation. So thank you. And I'm very open to questions about this topic. So I know we'll save time for that. So again, I'm Ariel, and I have been a physical therapist since 2002. I graduated from Boston University, and I became certified to teach Pilates in 2005. And I've used it as a part of my practice since then. I opened up Pilates Santee in 2008, which I'll talk a little bit more about. And I educate. So I'm very passionate about educating Pilates instructors on how to work with clients that have conditions or injuries. And I was a previous professional dancer. So here I am. I'm not sure what age I am in this picture, but I got on the Pilates reformer for the first time at the age of 9. So many, many years ago. In the early 1980s, I got to have the experience of a physical therapy clinic that had Pilates equipment in it, in Marin County, California, actually. And that became like a lifeline for me, essentially, because I was unable to dance at that time. I had not experienced an injury before. And I was able to continue to train both my mind and my body on the reformer. And so I fell madly in love with it. And I actually used it as a part of rehabilitation for many future injuries throughout my professional dance training. And then many years later, when I was about 18 or 19 years old, I realized that this was not going to be my career path. And so at that point, I decided that I really wanted to become a physical therapist and that I wanted to apply the Pilates method. And so I worked in traditional outpatient orthopedics in Los Gatos for 6 years. and really loved it. But I then chose to move on and open up my studio in 2008, where we currently have about 11 Pilates instructors and 3 physical therapists. And I'll talk a little bit about the type of injuries we see and how we work. So just a real brief background about Pilates. I think a lot of people think of it as just core strengthening. The videos that you can see online really often are more advanced type movement patterns, and that's not the type of Pilates we're often doing in the PT world. Really, Joseph Pilates was just incredibly advanced for his time, and he came up with what he felt was a method of exercise. And it was initially called contrology because it was all about how you move, how you organize the body. It was really not just about core strength. And so he developed exercises that are performed both on a mat and also a large variety of equipment, which he initially built himself. And a lot of it hasn't evolved, like it looks the same as it did in the 1940s. And I'm going to show some videos and photos of what that looks like later on. But here he is, this picture of him, he's 57 on the left, on the top left here, and then at 82 down below, which I think is pretty impressive how fit he is. And so the exercises are quite comprehensive. There's everything from mobility to strength to alignment to control. It's really not just about whether stretching or core strength. And I think some people have that concept in their mind. So again, I'll demonstrate some exercises in video, but really the concept here is that it's a method of exercise that can be applied in different ways, depending on who you're working with. And Joseph really wanted it to be a part of the medical community. In fact, rumor has it that when he passed away, he was pretty discouraged that the rehabilitation community hadn't embraced the work the way he wished that it had. So hopefully you'd be happy now because it's definitely becoming more mainstream. Okay, just a little bit about the principles. I'll just go over this briefly. Depending on your source, you're going to find different principles for the method of exercise. But some of the most important, I guess I'd like to say, is creating a connection to your center. So not just about engaging your core or your quote unquote powerhouse, but really moving from a place of awareness toward the midline of your body. And I'll show you some exercises by what I mean by this, but this is a really beautiful principle for people that were working with imbalances right to left on the body. Concentration is a big piece. As you get through the more advanced repertoire of exercises, there's definitely a lot of focus and intention that are needed to perform the exercise as well. Control is a big piece. So how we organize the body to have really effective quality of movement. In fact, I just thought I'd note that the Pilates instructor training is really comprehensive in teaching cueing, verbal cueing and tactile cueing, so that it becomes really a skill that the teachers master on how to teach good movement, not just through demonstration, but through education and cueing. And so we work really in slow, methodical ways to have people perform exercise as well. Precision is another piece, again, kind of going along the same types of idea of quality of movement. Flow is an interesting principle because initially when we taught this method, or when he came up with the method, there was an intentional sequence of exercises. In rehab now, you don't see that as much. We're really choosing exercises based off of the imbalances of a client or patient in front of us. But when you go into traditional classes, particularly places on the East Coast where the original method was developed, you'll see a very specific sequence of exercises. And he felt that this created a really well-rounded movement session. And then breath, probably one of the most important principles of Pilates. Really, Joseph Pilates felt that movement did not exist without breath. And we teach what's called lateral costal expansion breath technique, essentially really using the ribs and the diaphragm and the abdominal muscles and creating a connection to the core. And that could be a whole course in itself. But we teach proper breathing technique on day one at our studio because it's that important for the exercise method. So what is Pilates-based physical therapy? It's essentially taking Pilates exercises, whether you're performing them on the mat or on the equipment, And it's taking those principles and using it with people that have injury, pain, chronic conditions. And in terms of equipment, there's quite a bit, but the basic pieces here that I'll be showing some exercises from will be the Pilates reformer, the trapeze table or Cadillac. It's got two different names, the chair, and the core line. The core line was not an original piece of Pilates equipment. However, you'll see it in a lot of Pilates studios now, and you'll see why it's a really beautiful adjunct to the original equipment that he developed. So similarities and differences with traditional PT. Similarities, we're retraining poor movement strategies, we're tailoring exercises to the unique needs of the patient, and we're educating the patient on how to move better. In terms of differences, we're clearly using a specialized method, specialized pieces of equipment. Often the manual therapy is kept to the minimum, and at my studio, we don't have modalities. I don't think that's the case at every kind of clinic/studio. But that's basically the most basic similarities and differences. I really feel it's complementary. So 70% of our patients work with outside physical therapists and other practitioners. So it could be massage therapists, acupuncturists, chiropractors, and such. We see a lot of chronic pain, and so it needs a more comprehensive, well-rounded approach. I refer out a lot. So I'll refer out for people that I just think need more manual therapy work or modalities, really acute post-op patients, radicular symptoms or nerve pain, or just more complex conditions in general. So conditions that we treat. Right now at our studio at Pilates Sante, we have our youngest patient's 14 and our oldest is 86. So it's a pretty broad range of fitness levels and pathologies. We see a lot of spine pain, a lot of post-operative spine, arthritis and joint replacements of the hip, knee, and shoulder. We work with quite a few people that have autoimmune disorders, so Ehlers-Danlos, lupus, Hashimoto's, things of that nature. Often this is a comorbidity, so it's kind of secondary to other things they're coming in for. But these people that have these conditions tend to do really well, particularly with hypermobilities with the work that we do. And then osteopenia and osteoporosis, scoliosis, lots of sacroiliac dysfunction, pelvic floor issues, which I think Magda's going to talk about, and then just basic sprains and strains of the extremities like epicondylitis or shoulder tendinopathies, again, often happening in collaboration with other issues. So large variety here. So why Pilates? I mean, essentially, the take-home message is that for patients or clients that need to know how to move better, that need a focus on therapeutic exercise, this can be really effective. Managing and treating chronic pain, retraining faulty movement patterns, working with the aging population in a really safe way, restoring the mind-body connection, and then just improving general posture, flexibility, and strength and stability. What I love about the equipment is that this is a foreign environment for the client. So if we're trying to retrain a movement pattern, we can get them anti-gravity, we can unload their spine or other load-sensitive structures, and we can train them really safely to have this positive movement experience. The springs can be used as either resistance or assistance, depending on the exercise, and I'll show that in one of the videos. And then there's just an enormous variety of modifications and variations. It's endless pieces of props and equipment that we can work with people to just let them move and feel good moving. Okay, so here are some videos of me doing some exercises. This is the reformer. This is the basic studio reformer here. Developed by a company called Balance Body. That's one of the main manufacturers of Pilates equipment. And here I'm essentially just doing a kneeling plank on a moving carriage, but I've added in some dynamic, like some torso rotation and some upper extremity circumduction. Again, kind of more advanced variation. I'll just show that again. But what I love about this is I'm working on pelvic stability, as I get to move my torso. So whole body movement. And this is one of the exercises where the lighter the tension, the more challenging this becomes. So I really have to work to bring the carriage into home when it's light tension there. That's a more intermediate level exercise for sure. And then this is me on what's called the lawn box. This is called prone pulling straps. There's actually a lot of names based off of where you get trained, but the concept here is posterior chain strengthening and stability. I'm doing an oppositional movement here for my posterior sling connection. Go back for a minute, my right lat and my left glute. This can be really nice work for people to work safely on their posterior chain. For extension sensitive patients, I'll often teach something similar in quadruped on the reformer, which creates a lot of challenge with a moving carriage. We can also use different kinds of wedges and pillows underneath the pelvis or belly for people that can't lie prone like that. A lot of options. Here's me on the reformer again, and I'm doing a kneeling arm series. And I've added, again, a little bit more of like rotation, scapular retraction. But this is, again, a lumbopelvic stabilization piece. The carriage is moving. This is actually a little bit more challenging than it looks here. But I get to even work on my head, neck, shoulder organization. A lot of coordination going on here in the high kneeling position. There were so many exercises, it was hard to choose what to show, but I wanted just to get an idea. This is the trapeze table or the Cadillac. So this piece of equipment kind of can look a little bit intimidating. It was actually originally designed from a hospital bed. So apparently Joseph Pilates, like this looks like an old hospital bed, took the springs from the bottom of the hospital bed and attached them to the limbs to train these injured soldiers, like in the 1920s, like before he came over to the States to introduce the method. So this actually looks pretty similar, I think, to how it originally did. And here I'm just doing kneeling arms again. I'm on a stable surface now, but I'm working with unilateral stabilization, which I love. Actually, scapular stability and serratus anterior work. Again, a little bit more challenging than it might look here. For both the core and the shoulder girdle. And we call that hug a tree, essentially a chest fly. But I really love creating cross-body connections and cueing clients appropriately to create that stability, like whether it's anterior or posterior sling connection. Here's me, again, doing a little bit of single arm. I'm more in a lunge position here. I can also work on postural stacking here, which I could be doing a little bit better with my rib to pelvis stacking, but some scapular stability and some pelvic stability. So this is the core line. This was designed by a physical therapist that's from Australia in 2004. And he had Balanced Body, one of the main Pilates manufacturers, design this piece of equipment. So you'll see this in a lot of Pilates studios, but again, it's not one of the original pieces. One of the beautiful parts about it is a lot of upright work can be done on it. And so eventually our clients and patients have to get up and function against gravity. So we can't just keep them unloaded forever in all these sessions. So we want to get them up and practice different movement strategies, postural work, and gait work. So this is just me doing a lunge. But what I love is that I'm having to have my right leg, my right posterior chain really work against core tension here. And then I get to feel that sensation of my high hamstring and glute working. I've also just added a little bit of, again, torso movement on top. A lot of variations here, but it really feels great on the body. This is me doing what's called hoof, and this is a more kind of breaking down gait a little bit more. So here I'm working kind of push off, basically working into some plantar flexion, but also getting some posterior chain connection on my right, and then really working on pelvic stability on my left. There's terminal stance, stride length, really working on the length of stride, push off, which a lot of our clients are missing. Okay, here's me on the chair. I think this is the last piece of equipment. This is an exercise. It's a more advanced exercise. I don't teach it in a heel raised position very often. I'm holding what's called the magic circle or the ring. But what I love about this is you can do this completely flat-footed. You can use an unstable surface. But as I push the pedal down with my right leg, I can feel some oppositional length coming up through my left and through my head, like really axial elongation. It's a great sensation. So for people that were wanting to create some decompression, some lengthening in the spine, this can feel really good. It's also challenging balance. So it's good for anybody that we're trying to work on posture and balance. This is me prone on the chair working my back extensors. And here again, I am working quite a bit of lumbar extension here. This is not typically how I teach this. This is my range, but what's beautiful about this is you can adjust depending on the person's torso size, you can adjust where they're positioned on the chair. So we can emphasize extension where the person needs it. So if I'm placed back on the chair here, I can work more on my thoracic spine. And this is assisted extension. So this spring is actually helping me come up into that spinal extension. Then I'm doing some more posterior sling work here and a little bit more range than I would work with most people. But you get that concept. So I just wanted to present one brief case study just to give you an idea of like this is a great outcome, but this is like a very classic situation of what we work with. So Kristen is a 36-year-old female who presents with chronic intermittent central low back pain for the last 5 years. This was a gradual onset. She didn't have a specific mechanism of injury. And she came to me, she had had an MRI, which showed like one single level moderate L4, L5 disc herniation. Her primary goal was that she really wanted to run without back pain. So I kept the findings very generalized here because I know we have a variety of different people and backgrounds watching, but she had limited lumbar flexion mobility. So she had quite a bit of extension in her back generally and had a hard time reversing her lordosis. She had limited hip mobility. So her glutes, her hamstrings, her psoas were fairly restricted. She had some lateral hip weakness, and she had some pelvic obliquity. So there was some pelvic malalignment that was really transparent when she ran. So in terms of her home exercises, we just started with basic. This may even look very similar to some traditional PT work. We call it 90-90 toe dip, 90-90 abdominal work. I just added an isometric hand press, but there's a lot of variations here. We can do a crossbody hand press, an oppositional arm reach, and she did quite a few variations of that at home. She also did just a basic glute max stretch. I'll just fast forward this because it's a little bit long. I teach this almost like a reverse pigeon pose, and she did this a few times a day. And then she did some side lying hip work. Again, will look familiar. This particular variation, it's sometimes called side kick in Pilates, but it's with a straight leg. This was challenging for her. She's actually quite tall, so she had really long levers to work with. So we did a lot of lateral posterior hip strengthening. Here I was doing a basic glute medius raise. Yeah. Really slow and controlled. With and without resistance. That can actually be done on the reformer and the trap table too. So I think we did a combination of that. And then we just did a basic bridge. So we did bridges with marches, bridges with a single leg. This is me just showing very slow controlled bridges. I think we did some articulating or rolling bridges to try to see if we could encourage a little bit more lumbar flexion. But that wasn't initially. We kept her out of flexion. And then in terms of her sessions, so she came twice a week. Once a week, she saw a physical therapist. Once a week, she worked with a Pilates instructor. And I'm not showing all of the repertoire that she did on the equipment, but basically we worked on most pieces. We did the reformer, the trap table, and the core line. We did lumbopelvic stability, lateral hip strengthening, and then a lot of gait work on the core line here. So this is me just showing another variation where I have like an arm swing and some torso rotation happening. And then her outcome. So after 8 weeks, she was able to jog for about 30 minutes twice a week without latent back pain. So she was super happy. I think she wanted to run more, but by the time I stopped seeing her, I think we were capping at 30. She now works in small group classes at my studio. So she's had a great experience. Here's just a few studies that we need a lot more research and support for this method of exercise, but there's definitely starting to show some solid evidence that chronic low back pain, posture, balance can all be improved with the Pilates method. And there's just a couple of testimonials. I have been to many therapies over the years, and it's insane how much progress I had in such a short time. Not only am I healing and getting stronger and more stabilized, but I have developed a mind-body connection to prevent another injury. After seeing a PT for almost a year, my back pain and numbness in my right leg from my dance injury was still persistent, but within a month of Pilates-based PT, I was able to compete on the dance floor for the first time without any discomfort. Thank you very much. And if anybody has any questions, I'm happy to answer.
Thank you so much, Ariel. That was wonderful. Let's see. You may need to remove your screen share.
Okay.
Thank you. So if anybody does have questions, please put those in the chat and we will be addressing questions for both speakers at the end of the presentation. And let's see. Also, we're adding to the chat some links to various links. Ariel's business, Pilates, and we can put in the links for the San Jose District CPTA as well in terms of our social media. If you want to follow, again, this video will be uploaded to YouTube. So for future, if you want to share this with others, be sure to get those links that will be in the chat as well. And then we're going to move on to our next speaker. Okay, let me introduce Magda Nowosielska. She earned her doctorate in physical therapy, from the University of Texas Medical Branch at Galveston in 2019 after starting off as a PT assistant. She began working in the inpatient rehabilitation unit at Community Hospital of the Monterey Peninsula and later moved to outpatient PT care, thus treating a variety of orthopedic and neurological conditions over the course of her career. Magda currently works for Community Hospital of the Monterey Peninsula at the Montage Wellness Center in Marina, and last year she began specializing in women's pelvic health. She frequently utilizes the Pilates reformer with her patients, especially those with pelvic floor dysfunction. Okay, so Magda, if you could take it away, please.
Let me go and see. I don't see the screen. Just a second. Let me go and work on that. You guys hear me?
We hear you and we can see your screen, but if you could make your presentation to full screen, then it will be, more visible. That's perfect. Thank you.
Okay. And okay, let's go into this way. Okay, so thank you. Hello, everyone. Thank you, Krista, for introducing me. I have a question, technical question. Do you guys see this? Everybody? Okay, let me go and make this one smaller. I hope this one will work. So I don't have that extensive experience with Pilates as Ariel has. I just really started my journey with clinical Pilates a year ago when I started working with patients with pelvic floor dysfunction. And we use in our clinic reformer to address pelvic floor weakness, pelvic floor pain during the pregnancy. And after working for a little bit with reformer, I realized how wonderful tool it is, and I expanded it to the broader spectrum of population. And I think that it has really great physical and psychological effect. Ariel said that it works on strength, motor control, flexibility, alignment, posture, but it also boosts patient confidence and encourages them to stay fit. So Ariel talked about the core principles of Pilates and how Pilates can complement traditional physical therapy. I just would like to focus on a few distinctive aspects of Pilates, why it makes it, for me especially, so great tool in physical therapy. So we know that Pilates focuses on core muscles. It facilitates the motor control of the inner core. We have on the roof, diaphragm, front wall, it's our transverse abdominis, black wall, multifidus, and floor, which is our pelvic floor muscles. That core muscles are the systems that work together to affect stability, balance, and posture. And we know that the weakness in core muscles can lead to lower back pain, impaired balance, worse workout performance. And there is plenty of research showing that Pilates can improve strength of those deep muscles that ultimately will lead to decreased pain and disability. Pilates also emphasizes mobility and stability. And we need both of them to function optimally. And so it emphasizes dynamic stability. It's that movement, it's stabilized at all the time. And when we look at that exercise here, which is chest expansion in kneeling, first we recruit our local stabilizers, then global stabilizers, and then when stabilization is established, the efficient movement can be achieved. In addition to physical benefits, Pilates focuses on the mind and body connection, promoting mental well-being, with the focus on the breath, on all those principles. Ariel talk, concentration, breath, center, flow, precision. We can move mindfully through the exercise that in turn cleanses our headspace. By integrating the breath control and mindfulness techniques, Pilates encourages relaxation. It brings the awareness to the body, and it's really beneficial for reducing stress, anxiety, enhancing mental clarity, and promoting sense of overall well-being. And finally, Pilates is versatile and adaptable. Therefore, it's appropriate for any patient. It can be beneficial for an 89-year-old woman with osteoporosis recovering after a hip replacement, or to athlete recovering from rotator cuff surgery. It's motivating for women and men of all ages, and it really facilitates positive movement experience. And this is like, also I will talk about this, that people from physical therapy clinic, they will often transition to community-based classes. And there is also research saying that, showing that Pilates is reducing kinesiophobia. And we as physical therapists know that exercise and movement have enormous benefits on our health, and we know that movement heals. And so generally in my clinic, I started exercises on Pilates reformer, and then later transitioning to the mat-based exercises to provide people a home exercise program. And the biggest difference is the spring system that provides the dynamic resistance through the range of motion. And during the mat Pilates, the body weight resists the gravity, and sometimes it's too challenging for weakened muscles to complete the exercise with the proper form. Therefore, we can start on the reformer, where people feel challenged, but they had the same time spring provide the assistant guidance for the movement and enhances stability. I would just very briefly would like to talk about some conditions that they can be treated with Pilates in the clinic. So Ariel covered really Pilates for the lower back pain, and this condition is the most researched. And of course, benefits of Pilates for the lower back pain, they are such as core stabilization, choice of the flexion on extension-based exercises, improvement of the spinal articulation and posture. They contribute to decreased symptoms among patients with the lower back pain. There are well-documented benefits of Pilates in terms of reducing pain, decreasing disability, improving function and quality of life among people with the lower back pain. Pilates can also be used for the lower extremity pathologies, and there is a research showing benefits for post-surgical patients recovering after hip or knee replacement or ligaments repair to help to improve range of motion, strength, and motor control while providing joint unloading. We also know that proximal factors, they play a contributory role with respect to knee injuries. Therefore, impaired muscular control of hip, pelvis, and trunk can affect tibiofemoral or patellofemoral joint kinematics in multiple planes. And Pilates exercises incorporate pelvic and trunk stability, as well as a hip control, are a great tool for exercises, a form of exercises for people suffering from knee pathologies. We can also use Pilates for shoulder pathologies or neck. There's research that Pilates actually exercises might be superior to those traditionals, one in treating rotator cuff tendinopathies due to a focus on alignment, breathing, and incorporating closed chain activities. And finally, Pilates can be used among people with pelvic floor dysfunction. This is mainly when I use Pilates and reformer. And for people with urinary incontinence, Pilates exercises that target deep core muscles and pelvic floor muscles can improve bladder control. And the mindful engagement of the pelvic floor muscles during specific movements can train these muscles to activate the right time, reducing the instances of leaking. Additionally, improved core strength and stability gained through Pilates can provide support to the pelvic organs, reducing the risk of prolapse. And Pilates can also be effective in relieving pelvic pain, cause the muscle tension or trigger point. And because incorporating stretches and relaxation techniques into the routine, Pilates can help with tensioning the pelvic floor muscles. So this would be really that. And let me go and come back. Whoops. Okay. Here we go. So this would be pretty much that. Let me with my presentation. So I'm really excited about my journey with reformer and with Pilates, and I think that I'll be really adding more. And now I would I'm open to any questions.
All right, thank you so much, Magda. That was very very interesting and helpful information. And we do have some questions. There were actually some questions compiled before today's presentation. I think some of them were actually answered. I see one person has their hand up. And Jess, if you could actually put your comment in the chat, I will read the questions out to the speakers. That would be best. Thank you. And so some of these questions that we had were, I think, addressed, but some were not, or maybe need clarification. And I'm not sure if these are for one of you in particular. So, whoever feels like they could best answer. Okay, well, a most recent question that I have always wondered as well is, when using reformer springs, how do you document the resistance that you're using?
Well, I'll answer. So we're a little bit old school still at Pilates Santé. So we have paper charts, and actually the instructors are taught how to document soap notes. And all of the charts have what's called exercise flow sheets. And in that, we're documenting blue, red, yellow, things of that nature. So you can see the progression.
Okay.
We do the same, the color coding.
Color coding. Okay. And as a PT, where can I get Pilates training to incorporate these techniques into my practice?
So I started, I know that Ariel has a lot of experience. I just started with Body Balance. It's a company that actually produces a lot of Pilates equipment. And I like it because I have the feeling that it gives you some options. It can be chosen if you want to concentrate on the reformer, or you can do the mat, or you can have the whole pathway. So you can choose just some parts or the whole thing. That's why I like it.
Okay.
Yeah,
Yeah.
there's a few really large organizations that kind of have long, extensive trainings. Balanced Body, Polestar Education, Bozzy, those are just a few. So for people that really want the work comprehensive, it's a great option. It is costly and time consuming. There are some smaller training certification programs you can go through. On the Move with Alyssa in Belmont, California. She does a training that is excellent. She's a physical therapist. I'm in the process of beginning to try to develop a training program as well. And then essentially, after you've completed the training, you complete a test out process that makes you a certified Pilates instructor.
Okay.
I hope that answers that question. So
I think so. I think you two did a good job. That kind of segues into another question, which was, can any physical therapist do Pilates rehab with their patients, or must you be certified?
shall I go or? Yeah,
Sure.
okay. That's a really tricky question and a good question. So I feel like if you want to teach this method well, go through a training program. I mean, that's really the correct answer. There are principles and there are exercises that physical therapists can learn and apply to use. So for instance, I've gone to some local physical therapy clinics who decided to purchase equipment, and I taught them some really fundamental work that they could use the equipment safely with patients. But in terms of like having it be a bigger piece of your practice, you need to go through the comprehensive training. But yes, I would love to see more physical therapists using the method in the clinic, because I'm so passionate about the results that you can get. Just having more tools in your toolbox to work with people,
Thank you. This question will be more for Magda, I believe. How do you use the Pilates equipment to progressively address patients' pelvic floor prolapse symptoms?
So that's a great question. In like reformer will actually, as I said, it can unload the joints and the spine. So we can use it in the gravity eliminated plane. We can put patients in prone, supine, quadruped, which is pretty often those positions beneficial for people with prolapse. And of course, increasing the resistance when they are able to stabilize through that movement that they are doing, to be the progression. Also, I think that really with the prolapse, the breathing, it's very important. It's essential. And actually on the reformer, I have the feeling that it's the resistance of the springs actually really helps to people to connect and build up that good movement pattern with the proper breathing without creating increased intra-abdominal pressure.
Okay, and I'm actually, out of curiosity, I want to make sure that I understood something correctly as you two were presenting. When you say increasing the resistance, so in certain positions, you can actually add more tension on the springs to make the exercise harder. But in other positions, am I correct that by reducing the resistance on the springs,
Yeah.
like the video that Ariel showed, it would make the exercise more challenging, and that would still be a progression to a more advanced level. Is that correct?
Yeah, exactly correct. Because of course, when you, and this is what I had on one of my slides, with increasing the resistance, you are concentrating on concentric action. With decreasing, you actually will address that eccentric. You actually need much more stability, and I will talk about that. So that's why it just, at the beginning, at least I put kind of patients in the middle because they are not ready for enough like bigger resistance, and they still need that stability which comes from the springs. And later you can kind of progress them both ways, adding resistance to some exercises and some actually decreasing the resistance.
Okay, thank you. So it really does take knowing the equipment and understanding these exercises to smoothly progress your patients, I can see. Let me get another question. Are there any conditions that you should not treat with Pilates, in your opinions?
It's another good question. I mean, I refer a lot out to physicians. I mean, I've been practicing in Los Gatos for a while, so I kind of have the people that I trust. So if I'm ever evaluating someone and it seems that there's something that's been needs more further diagnostic workup, then I'll just refer out, and often refer not just to a physician, but then potentially they're working with another therapist. In terms of not being able to apply the work, it doesn't, trying to think of any particular circumstances, but not really. I do have a patient right now that has, well, more than one, but with brain cancer, and I'm doing more neurological rehab with her. She's had tumor resection, and she's had some loss of, um, function on one side of her body. So there's definitely been times with her that I speak to her other treating practitioners quite a bit because there's more complexity there.
Mhm.
But yeah, and I just refer out for things that don't look safe to me. But there's no particular condition that I say I won't work with someone, if that makes sense.
Yes, thank you. We do have time for one more question, and I think it might be a big one. So we'll probably end with this one. The question is well, it's kind of two parts. How would a patient know when they would benefit more from Pilates-based rehab over traditional PT? And are there specific indications you have found for increased success or outcomes with Pilates-based rehab?
Do you want to speak, Magda, or?
Yeah, go ahead.
Okay. How would they? So when somebody comes in and they go through the initial evaluation, for our studio, most of them have had traditional PT or are already in traditional PT. So I work with that person that's coming in to share what we would be doing differently or complementary to their treatment plan. If somebody's already had a lot of traditional PT and they're still looking to manage a chronic condition, that is usually up our alley. So that's going to be maybe answering part one of that question, is that the person could benefit from continued rehabilitation with some variation. I don't necessarily think it's just one or the other. Again, I think these two forms can complement each other.
Yes, and I kind of do the same thing. They come to me just for the regular PT, and I try if it's possible, especially for people with chronic pain or this like kind of, I have the feeling with the orthopedic conditions, not the pelvic floor, that they are stuck, there's not that much of the progress. I want to try like this kind of the approach. And very often actually, because this is what I said, people are encouraged to move. They like to move. They actually, it's that confidence, it's that moral control they are getting, and they're just really moving the movement patterns. And sometimes you just need 1 or 2 sessions, or just even like a couple of the exercises on the reformer, that they actually changes a little bit that the pathway of the traditional PT. So this is my approach to that.
Okay, great. Thank you two so much. Well, I think okay, we can finish here unless there are any last minute questions coming in. For those of you in the Zoom right now, please check the chat, take down those links, those resources that were added to follow the San Jose District CPTA. We thank everybody for participating today, and whether you're listening right now or listening to watching this as a recorded session later, whether you are a physical therapist who's looking to potentially incorporate Pilates into your training, whether you are a patient who is wondering if you should try Pilates and or Pilates rehabilitation, or whether you are a Pilates instructor and you'd like to network with a PT who maybe has these similar interests and who can work together. We really hope that you have enjoyed today's presentation, and again, we thank you for joining. Okay.
Thank you.
Thank you.
All right. Have a good day, everyone. Bye.